Guided implant surgery is a huge advantage over freehand surgery when it comes to the accuracy and safety of the procedure. Essentially, when we're placing dental implants, we're drilling a small hole and then we're widening it and we're placing a titanium screw into the hole. And we need to be extremely accurate when we're doing that because we're operating in a very small area. So when we do guided surgery versus when we do freehand, for guided surgery, we use a computer to plan the case. We're looking at the 3D images and we're placing a virtual implant. We can then tweak the position of that implant and we can base the entire plan off the patient's planned tooth position. This allows for us to then take the plan we did on the computer and translate that to the actual patient so that the implant goes exactly where it needs to go. This means that we have greater predictability for the crown that will eventually go on top of the implant and greater longevity because we're not going to have any deviations from our plan to what we actually did. With guided surgery, we can confidently avoid injury to those areas, whereas with freehand surgery, we're taking a risk. So for that reason, guided surgery in our practice is the standard that we use for dental implant surgery. And using the technologies that we have available, we're able to do things for patients with smaller incisions and more precise surgery so that patients do have a quicker recovery. If you're interested in learning more about guided implant surgery or dental implants in general, please come see us here at Texas Center for Oral Surgery and Dental Implants. We'll show you your situation, we can look at your images and come up with a great plan for you.